Our presenter today is Stella Hart. Stella is an experienced healthcare marketer and editor. As a former social worker and patient education writer, she's passionate about health literacy and giving patients the tools they need to take an active role in their care. At Geometric, she uses data to drive strategic marketing recommendations and develops engaging, SEO-friendly content that reaches the right audiences at the right time and drives conversions. She holds bachelor's degrees in English and music from Drake University and a master's degree in strategic communications from the University of Iowa. So take it away, Stella.
Thanks for that great introduction, Cole. I'm excited to present today's webinar, which offers an overview of the Geometric content team's best practices for writing for online healthcare audiences. I hope today that you find a lot of great practical tips that we'll cover in the next hour. But if there's really one major takeaway that I want to emphasize just as we're getting started, it's that no matter what new trend or technology you're optimizing for, well-written content that answers users' questions and helps them complete tasks always performs. We work in an always evolving and changing industry with accessibility requirements, important cultural shifts toward inclusivity, and an ever-changing search landscape demanding our expertise. The COVID-19 pandemic accelerated many aspects of healthcare's digital shift, and this includes user-friendly digital content, which is now not only a competitive differentiator, but a critical crisis communications tool to inform members of the public and dispel dangerous misinformation. Today, you'll learn how to develop SEO-friendly web copy that meets the needs of your users while supporting your organization's goals in a post-pandemic world. Today, we'll be talking about how and why we read on the web, 3 steps to great web writing, how to incorporate SEO best practices into your content, accessibility in web content, and then we'll walk through some additional content resources that you might be interested in. So before we start talking about the most effective ways to write for the web, let's take some time to look at how people read online and consider why they're coming to our website in the first place. So a Pew Research study that just came out this year in 2021 says that 85% of Americans access the internet each day, and a third of those say they're almost constantly online. This is actually a significant increase from the last time this study was conducted in 2018. And maybe this resonates with you and your own online behavior, especially during the COVID-19 pandemic. We're motivated to go online to complete specific tasks, including looking up information about a location, including driving or walking directions, a location's hours of operation, their contact information, and more. In fact, a third of all online searches on a mobile device is location related. We also go online to communicate with our family, friends, coworkers, and others via texting, instant messaging, email, social networking sites, video calls, and conferences. We also go online to stream podcasts and music and watch videos. We're choosing entertainment when and where we want to consume it. We go online to shop for products and consumer services and make purchases and reservations and appointments. We're online increasingly to work remotely, search for a job, or sell goods or services to others. We go online to share our experiences, like business reviews, blog posts, videos, or other original content. And we also go online to explore new or trending subjects. So this is kind of a wide array of different activities, but one thing ties them all together. They're all action-oriented. In each case, we're going online because we want to solve a problem or complete a specific task. As user experience expert Jerry McGovern says, when it comes to developing content for your website, one of the most important things to remember is that nobody cares about information for its own sake. The customer has a task they want to complete or a problem they want to solve. And that's just as true with hospital or health system websites as it is with any other business or organization. Your website should help patients and your users when they are hoping to choose a pediatrician for their new baby. They're dealing with knee pain and they want to understand what are their options to alleviate that. They might be looking for a job or they want to pay their hospital bill. When they land on your website, they already have that specific task in mind. So it's our job as web writers to help them accomplish that task by clearly communicating the information that they're looking for. So let's dig a little bit deeper into the health specific reasons that users go online. So even before the pandemic, 95% of Americans reported having used the internet to find healthcare information. A consumer survey asked adults who engaged in health related information online searches to select which activities they participated in. And the most popular by far were researching specific conditions and symptoms or specific treatments. And the majority of consumers said that the internet was the first place they turned when they or an immediate family member had a health issue or concern. Other popular health-related online activities include communicating with a doctor or other type of provider, researching diet and exercise, and searching for a local healthcare provider. Let's dig a little bit deeper into a key healthcare market, and that's seniors, and their comfort with using the internet to research health information. So you may be aware the US has an aging population, and in 2019, about 16.5% of the American population was 65 years or older. That's a figure that is expected to reach 22% by 2050. And the latest data we have from the US Department of Health and Human Services, which doesn't yet include pandemic data, seniors account for more than a third of healthcare spending, with approximately 96% of them accessing care annually. And seniors are increasingly online. A survey that came out this year in 2021 found that seniors, like all demographics, increased their internet usage during the pandemic. And the same study shows healthy living education and researching or purchasing medical services, including accessing telemedicine and virtual visits. These are activities that are bringing seniors toward the internet. When someone lands on a web page, what do they see? How do they consume the information that we give them? On the web, people don't read every word on a page. Instead, they scan. They're naturally attempting to be efficient and put in the least possible work for achieving their goal. They've learned that scanning can deliver almost the same amount of information as reading, but with significant less time and effort. And writers, we have the opportunity to influence the way consumers scan pages through the way that we structure and format our content. So first, it's important to keep in mind that the way people read online depends on a few things. Their task. So are they looking for a specific fact, browsing for new or interesting information, or researching a topic? It also depends on their assumptions from previous experiences with the internet, your website, or your brand. The way people read online depends on their motivation. And that means how important is this information to them? What is their level of focus? How focused or unfocused is the user on the task at hand? Are they really motivated, very focused, or are they multitasking and only slightly interested? It also depends on the type of content, the formatting and page layout of that content. And it also depends on the person. So while some people prefer to scan when they're online, even if they're highly motivated or focused on a topic, other people may be very detail oriented, even when they're online. So they do take the time to read word by word. Eye tracking studies reveal that people whose primary language is English consistently use specific patterns when reading on a desktop or laptop screen. On pages with large chunks of text and few subheadings or bulleted lists, users tend to scan pages in what we call a classic F-shaped pattern. They fixate on the words toward the beginning of lines and toward the top of the page. When we, as writers, incorporate useful subheadings, users are more likely to use a layer cake scanning pattern. They scan headings and subheadings without reading the text below until they locate the heading that they're interested in. And at that point, they read the accompanying body text below. So this is one of the most effective ways users can scan pages. Researchers have identified many other scanning patterns that are affected by the user's task, personal characteristics, and other elements that we discussed on the previous slide. Note, these are patterns for readers whose primary language is English, and I think we can agree that the layer cake pattern is the most deliciously named. I won't read all of the different patterns that folks have identified in this list. You can see the source URL referenced at the bottom of the slide if you're interested in learning more about them. Just suffice to say, there are many different identified patterns, and they can tell us a lot about how users consume content online. The important takeaway is that when you understand how people read web pages and the range of devices that they use, you realize the importance of first sentences, headings, subheads, link text, and bulleted lists. So this is the harsh truth for us writers. So most of the time, the majority of our content isn't going to be read closely. Usability expert Jacob Nielsen says that on average, users have time to read at most about 28% of the words during an average visit, and 20% is more likely, but that's okay. When you follow our steps for great writing for the web, you'll help your users find that 20% of content that they're most interested in. And that's the content that helps them accomplish the task that brought them to your website in the first place, which we can then align with your business goals in order to drive desired conversions. Best practices for web writing boil down to 3 major items. Keep it simple and scannable, focus on the user, and make it easy to take action. So it sounds easy, but all of these elements take a lot of thought, effort, and practice to do effectively. Let's start with keeping your writing simple and easy to scan. Simple, concise writing benefits everyone, including people reading on their smartphones or those who use screen readers or other assistive devices to navigate the internet. So to keep your writing simple, get to the point. In the news industry, they say don't bury the lead. And what that means is put the most important information first, where your readers are most likely to see it. Eliminate rot. So rot is an acronym that stands for redundant, outdated, or trivial content. And by trivial, we mean information that's not important to your primary audience. When you do need to use medical jargon or other technical terms, abbreviations, or acronyms, which sometimes we do in healthcare, take the time to explain them. This will also help keep your reading level at an appropriate level for accessibility standards, which is something we'll go into in a little bit more detail later in our conversation today. Use active verbs and an active voice to keep readers engaged. And use plain language. These are the words that your audience, typically patients and their families, are comfortable using. Which leads me to my next point on health literacy. So simplicity helps everyone, but it's especially important for your users who may have low health literacy skills. Only about 1 in 10 adults is considered fully proficient when it comes to health literacy. That percentage is even lower among older adults, so those who are 65 and above. And even people with strong general literacy skills and advanced education, they can face challenges obtaining, processing, and understanding health information when they're facing a serious illness, they're unfamiliar with medical jargon, or they may be trying to interpret information in order to make a healthcare decision. So health literacy is different from general literacy. And we know that being under stress, such as maybe you're experiencing really uncomfortable symptoms or you're worried about a diagnosis, that can impact your brain's cognitive load and the information that you're able to process. Patients from all levels of health literacy depend on the internet to help them make decisions about their healthcare. And that means that if we want the majority of our website visitors to understand us, we need to avoid medical jargon, speak plainly, and explain any healthcare specific technical terms and acronyms. And as I mentioned before, this can help you keep your content compliant for accessibility standards. So people with low health literacy may have difficulty managing a chronic disease like diabetes or high blood pressure, doing healthcare or self-care tasks that require math skills, like measuring medications, understanding nutrition labels on food packages, or calculating their blood sugar levels, navigating the healthcare system, and that includes filling out complex forms or locating providers and services, understanding their diagnosis and their options for treatment, and understanding the connection between lifestyle choices like diet, exercise, and smoking, and sleep habits as well, how those have an impact on their overall health. They may also have trouble evaluating the reliability of a source of information and telling the difference between fact and misinformation. And this, I think, is something that in our industry we've been talking about for a while, but was really brought into high relief during the pandemic when it came to communicating about the pandemic and more recently about vaccination efforts. Poor health literacy is linked to higher rates of hospitalization and emergency room visits, higher risk of complications, increased healthcare costs, and longer recovery times, as well as just generally poorer health outcomes and shorter lifespans. A person's health literacy level may also affect satisfaction with their care because it causes miscommunication between patients and providers and unclear patient expectations. So, as healthcare writers, we're encountering medical jargon and academic language all the time. And that's because we rely on doctors and other providers to share their subject matter expertise. So, it's our job to learn their language and then simplify it, translate it for a patient audience on the web, making it accessible. So, the phrases from the column here on the left, they all come from service line content that Geonetric rewrote for a client. So let's think about this. How would you say seek prompt medical attention more succinctly? Or hematological disorders. I can't even say that one out loud. So you'll see in the examples now on the right, we replace these medical phrases to become more familiar language. So we're saying blocks blood flow instead of obstructs circulation, for example. We also simplified copy by using more concise and conversational phrases. For example, saying doesn't use instead of does not require the use of. This type of plain language makes life easier for your consumers. Here are a couple of free online resources you can use when you need help translating medical jargon to plain language. And as Cole mentioned, we have that third edition of our Writing for the Web for Healthcare ebook that is also chock full of a lot of great resources that can help you not only with plain language, but all sorts of different government and other websites that you can bookmark and reference often to make sure that your content is clear and follows plain language guidelines. Keep your text clear, concise, straightforward, and lively by using the active voice as much as possible. So I'll put on my language arts teacher hat. Let's do a quick grammar review. So with the active voice, the subject performs an action. The nurse called the patient. Here, the nurse is the subject and the nurse is doing something. They're calling the patient. On the flip side, with a passive voice, the subject is acted upon by the verb. The patient was called by the nurse. So here, patient is the subject, but the subject isn't doing anything. The subject is just receiving the action, which is the call. So in this case, I think you can still understand the meaning of this sentence when it's in passive voice, but usually writing in the passive voice can make your copy needlessly kind of awkward and vague and much wordier than writing with an active voice. So switching to that active voice, that can help you tighten up your writing. We often find passive voice in scientific and academic writing, so it's not too surprising that it creeps into healthcare websites. After writing your page, look for sentences that include forms of the verb be. For instance, am, are, is, was, were, or has been, along with the past participle, the verb form that typically ends with the letters ed. So this can help you spot instances of passive voice. Then, try to rewrite the sentence using an active verb. So here's how you might rewrite this copy using an active voice. So instead of saying, therapists are selected by patients to best fit their clinical needs, you could rephrase this to say, select a therapist who fits your clinical needs. And then in the passive example, instead of saying something like is negotiated, The active voice flips that around to say, you'll work together to create a treatment plan that fits your job, school, and/or family responsibilities. At Geometric, we use a free online tool called Hemingway Editor to help us spot passive voice. It also highlights other ways that we can improve the simplicity of our text. As you can see in this screenshot here, it's calling out difficult sentences as well as extremely complex sentences. So this is a super great free tool. You can use just copy and paste your writing into it, and it'll point out some of those areas that you may want to address. Something else that we really love about this tool is that it gives you a readability grade level. So as you make updates to highlighted text and you're trying to make your writing more clear using more plain language, you might notice that the grade level should go down, and that's great. So WCAG guidelines say that for the highest standard of accessibility, you should aim for a reading level of 9th grade or below. And Nielsen Norman Group recommends 10th grade for audiences who are highly educated and experts in the topic at hand. So keeping your content at that recommended 8th or 9th grade reading level, that will make sure that your content is accessible. Good web copy has a lot in common with good news writing. It gets to the point quickly by using the inverted pyramid. With this communication style, you start with a concise summary of the most important information, and then you provide supporting details below in order of their importance. So let's look at an example of how this could work in a healthcare service line page. So this is a page about care for epilepsy. We lead the page with the most important thing that we want our audience, that is prospective patients and their families, to know. They can receive high quality testing and treatment for epilepsy at this organization. You could also think of this as the conclusion that you want your readers to come to after they read the rest of the page. Underneath, you'll see the information that supports your conclusion, including details about the care patients will receive at their first visit and specific diagnostic services available. This hierarchy also creates a more accessible experience since it uses headings to organize content on the page. And again, that's something that we'll dive into in a little bit more detail later in our conversation. Simplicity on the web is more than just words, it's also about format or structure. So think back to those eye tracking studies we talked about earlier. We know that people go online to find specific information, and we want to make it as easy as possible for them to find what they're looking for. As a writer, you can do that by using a page structure that supports scanning or skimming. To do that, cover just one topic per page. Keep your paragraph short. Use bulleted and numbered lists to break out a series of information. Include straightforward headlines and subheads that tell your reader what type of information they can expect to read, and use short sentences. So this is a page that Geometric rewrote as part of a content development project. And you can kind of see, if you sit back in your chair and squint at it, the copy really just looks like a big gray blob of text. The headline does stand out. So I know when I read this that this is a page about low vision services. But I have to really sit down and read line by line, word by word, to discover the topics that are covered on this page of text. The topics are: what is low vision, the causes of low vision rehabilitation program services, and how to get an eye evaluation. So how can we pull these topics out of this big blob? How do we make it as easy as possible for users to scan the page and find these topics as quickly as possible? On the right, you'll see that the new content we created for this client. There's not much new information. It's just broken into smaller chunks based on those topics that we identified. We added subheads so the user can quickly see what information is covered on this page and zero in on what's most important to them. We kept the sentences and paragraphs short, in part by breaking out lists of symptoms and conditions into bulleted lists. And then finally, we moved this information about the need to see a doctor for an eye evaluation into a call-out box so that it stood out more clearly. We also added a link here to the client's list of ophthalmologists to make it easy for the user to find a doctor within the health system. And if you take the time to read through the copy, you'll notice we shifted from a passive voice to an active one. We also began directly addressing the user, using the word you instead of the third person. And that's part of our second step, focusing on the user. So start by defining who your audience is. Your site's primary audience might be patients and their families, but there may be some other sections of your site that are aimed at other groups. So the audience for your careers section most likely is job seekers. Once you've identified the audience for the page or section that you're writing, take a moment to visualize them and consider, what does your user want to know? What are the questions that they might be seeking answers for? How will your service or product make your user's life better or easier? What's in it for them? What would make them want to choose you instead of the clinic or your competitor down the street? And what's the next action that they should take after reading this page? Do you want them to make an appointment, sign up for a screening, register for a class? What's the end goal that they want to move toward and that you want them to move toward as well? So, most online healthcare research is done by a prospective patient for themselves, but we also see a lot of people researching for their loved ones, especially for their partner or spouse or a child. So, for certain service lines, it's likely that some or all of your readers are not the patient themselves, but most likely a caregiver or family member. Pediatrics is one example. Others include pages about certain services for seniors, such as treatment for dementia. So, in these cases, consider not just what the patient may want or need to know and how they'll experience the care that you offer, but what does their family member want or need to know? Do you involve caregivers in the patient's care in certain ways? How do you make their lives easier as they're helping their partner or their child get the care that they need? Try to keep these answers to these questions in mind as you begin writing the text for your page. And remember, this page isn't for you or your organization, it's for your users. So speak to them, not at them, as if you're having a conversation. So if a patient or family member were to walk into your office or call you on the phone, you would address them directly. You'd use the word you instead of the patient. So do the same thing in your web page writing. Write to the one person who is reading your web page, not to a nameless, faceless crowd. Anticipate your users' questions or concerns and address them in your writing. Focus on how patients and families benefit from your services, your facilities, your technology. Don't just tell them that you have a cool piece of tech. Explain how it's going to help them have a better experience or a better health outcome. And finally, keep your web page text warm and conversational. Write like you talk. And that means using all the techniques that we talked about earlier for keeping your content simple, using the active voice, writing short sentences, and using everyday words. And remember that in some cases, you're writing for people who are going through a difficult time. So be sensitive, be empathetic. I love this quote from Anne Handley. She's a content expert who says that even when you're marketing to your entire audience or customer base, you're still simply speaking to a single human at any given time. Worry less about sounding professional and worry more about creating remarkable content that other humans can relate to. One way that you can be warm and empathetic is to use people first language. That means making word choices that avoid making assumptions, labeling people, or defining them by their health condition or another trait or characteristic. And here are another couple resources that you may want to bookmark that can help you put the people you serve first and keep a warm and welcoming voice. Another way you can be empathetic is to put the reader at the center of your content. When you're writing about your organization's services, treatments, amenities, or other features, imagine the patient asking you, well, what does that mean for me? Until you get to a tangible benefit. So if you have a sentence you're starting off with, we offer a minimally invasive total knee replacement. Well, Joe Q patient asks, what does that really mean for me? Well, it means the surgeon doesn't have to cut as much of the tissue around your knee. What does that really mean for me in terms of how I'm going to benefit? You'll have less pain and scarring, and you'll heal faster. Here's another example. When surgery is your best option, choose a minimally invasive knee replacement procedure at Benefit Health System. Your expert surgeons will use a small incision so you have less pain and scarring. That means you'll enjoy a quicker recovery and get back to the activities you love sooner. So everything about this rewritten content centers on the user, from the active verbs, words like choose, use, and enjoy, to the use of your to describe the expert surgeons, because they're members of the reader's healthcare team. And you'll notice we don't use the word cut anywhere, even if we know that that is what happens. Nobody wants to read that word when they're thinking about getting a procedure. So that's just part of being sensitive to your users, choosing language that isn't going to scare them, but try to really strike a reassuring, empathetic tone. And finally, make it easy for your users to take action. You publish this webpage for a reason. You want your user to do something after they read it, whether that's finding a doctor or signing up for a class, making an appointment. Those are just a few examples. Every page should include a single, strong call to action that directs the user on what to do next and prompts an immediate response. The best calls to action are clear and concise, prominently displayed even on a mobile device so that the audience sees the CTA when they're scanning the page, relevant to that page and the page's audience. And finally, whenever possible, choose a CTA that you can track. So that helps you measure the effectiveness of your page so you can make adjustments as needed to improve your site's performance. And use active words to make your calls to action effective. Encourage visitors to take the next step with verbs like make an appointment, enroll, and sign up. If possible, let your user take that next step online. If they're initiating contact with your organization via your website, it's most likely that they want to complete tasks like scheduling appointments, viewing test results, paying a bill, and completing and submitting forms online. We have covered a lot of material, so let's just take a minute to review our steps to great web writing, and then we'll move on to talk about the intersection between content and SEO. These are the 3 steps for great web writing. Keep it simple and scannable, focus on the user, and make it easy to take action. These concepts are at the heart of everything that the content team at Geometric delivers, and we encourage you to make them the heart of everything that you write for your organization as well. All right, let's shift gears a little bit and talk about the connection between content and SEO, search engine optimization. Google has long insisted that good SEO comes from great content that meets the needs of users. Of course, you must also use effective HTML page titles, meta descriptions, alt text, and SEO-friendly URLs. But in the end, the true driver of your search engine ranking is the quality of your page content. On average, about 51% of website traffic is organic traffic. That means visitors who are coming to your website as a result of unpaid search results. So that means you're not just writing for the users who are already on your site, you're writing for those who are trying to find you via Google and other search engines. Some of the most important factors that Google looks at when ranking web pages include the quality of your content. Remember, content is king. Are there links to and from the web page? Localization, or how relevant your content is to local searches, as well as user engagement. So are users clicking on the page when Google lists it in search results? And then what's their behavior when they're actually on the page? What keeps a user on your page? What brings them to your site to learn or take action? Search engines love content that answers users' questions, incorporates words that they're using, or keywords, effectively and in context. Google and other search engines love content that's well written and regularly refreshed and updated, as well as content that offers value by providing original, useful information and uses headings to provide structure and context. Search engines do not like duplicate content or plagiarized content. They are also smart enough to be able to identify keyword stuffing. So this is a practice that means using irrelevant keywords or repeating the same words or phrases in an unnatural way. The lack of and or improper page structure of content is something that search engines don't appreciate. They also don't care for thin or non-meaningful content. I think we've all been frustrated at one point when we've gone to a web page, we think we found the answer to our question and it says something like coming soon. So Google doesn't like that either. Healthcare is a local thing. So most searches for healthcare or providers are tailored to a certain geographic area. And Google likes content that is localized. So take this a step further when you're writing a location profile or content about a specific location by noting the address, phone number, and local landmarks or wayfinding terms. This is information that's helpful when you're trying to find or learn about a specific location. Here's an example of a location profile, and you can see called out there are several relevant geographic locations in the copy to boost SEO and help users find this practice without it coming across as unnatural. Write content that gives your users what they want, and the search engines will help them find you. If you have content that meets the needs of a searcher, chances are good that you'll show up in search engine result pages. But we can help search engines better understand what's on our page and how it answers those users' questions with a few simple techniques. So you heard me mention keywords. So what about them? They're important to your rankings too. And that's because keywords give us really great insight into what topics our audience is interested in and the terms or phrases that they actually use. So are people in your area searching for cardiac surgery or heart surgery? When you use keywords well in your content, it helps search engines and your users understand what a page is about and how it's going to answer those user queries. To use keywords well, incorporate them naturally and in context. Google gives more weight to keywords that are used in certain areas of your website. So, as much as possible, work your keywords into your HTML page title, meta description, headings, image titles and alt text, your URL, and your link text. And I'll go into more detail and provide some definitions of these terms in the next few slides. So an HTML page title or a title tag defines a title in the browser toolbar and in social media, and it provides a title for the page when it's added to your favorites. It also makes the page more accessible as long as it's written well. Here's an example of what a page title looks like in search results or when a page is posted on social media. How should you write an HTML page title? Be concise. Keep your page title 50 to 60 characters or less, and that includes spaces. If the title is too long, search engines will show an ellipses or a ... to indicate that a title tag has been cut off. Place important keywords closer to the start of the title. Industry testing has shown that this helps with your search ranking and click-through rates. Next, let's talk about page descriptions. The page or meta description is a snippet that summarizes a page's content. Google tells us that it doesn't look at the actual page descriptions when determining rankings, but it has a huge impact on user behavior, and that includes click-through rates. One of the best ways to improve your click-through rates is to write effective meta descriptions. You can see some examples of those here. So how important really is a meta description? So 63% of respondents to a survey said it's the most significant element of their decision on whether to click through from a search engine result page to an actual web page. Your meta description can also affect your bounce rate, and that's the percentage of sessions where a visitor leaves your site without interacting with the page. Google considers fast bouncing a sign that the page isn't giving users the information they're looking for. So, a accurate, well thought out meta description can tell your user what to expect from that page before they click through to it, which can help your bounce rate go down. And that in turn helps your SEO. So, how do you write a good meta description? Google may penalize you for mass duplicating your meta description, so it should be unique for each page. Be concise, or Google will cut off your page description. It also has a tendency to cut off after any type of end punctuation, so multi-sentence descriptions could get cut off. I think that's my sign to take another sip of coffee. All right. Make sure your meta descriptions are compelling, relevant, readable copy that would make sense out of context. Think of the meta description as an advertisement for your web page. And when appropriate, write a description that invites a response or piques the reader's curiosity to make them want to click through. And incorporate important keywords. It's a small thing, but it's worth the time. If you don't write a description, Google will pull text from your page, and that might be the first sentence or a combination of the headers and paragraphs on your page. Other times, the description it pulls in will depend on the search terms used. Here's an example of what happened to a geometric client before we revamped their content. Because this page didn't have a meta description in the metadata, Google pulled the first text it found and displayed that on the search results pages. So you can see instead of describing the health system, it talks about community education, which is just a very small part of what this health system offers. Keep in mind that even if you write a page description, Google can still pick out text from the web page for its search results if it thinks that text is more relevant to searchers. So the better you write your page content and your descriptions, the more likely it is that Google will use what you created. Here is a formula that can help you get started. So writing in a user-focused way, start with the action you want the reader to take, name your organization, add the city and state to localize the description, and then highlight the benefit the user will enjoy if they take that action. And here's an example of how that could look. Get advanced treatments at Benefit Hospital Cancer Care Center in Cedar Rapids, Iowa, where you'll find support from our friendly, trained professionals. Let's talk about URLs. URLs should be simple, direct, descriptive, and easy to read. Use relevant keywords, but use a keyword just once in each URL. You don't need to overload a URL with keywords or repeat keywords. You can remove stop words like and, or, but, of, and the to shorten your URL. I think the only exception really is say one of those stop words is part of a branded term, then you would include it. So if you have a cancer center at your organization and the name of the branded term you use for that is the cancer center, it would make sense to include that in the URL. And here's a couple examples. You should be using hyphens to separate words and not underscores. So link text. One other item to consider when writing web content is the link text. It's the text that search engines and site visitors use to understand where a link will take them when they click on it. When you're writing these, be descriptive. Resist the urge to use click here or learn more. Write the link to describe the subject of the link to page, document, or site. This is especially important to follow in order to have an accessible web experience for your users. What are the benefits? So, link text with targeted keywords improves your search engine ranking, it generates more web traffic, and it results in better content because you have to think more carefully about what you write and how you create links. It also helps users trust your site and your brand because they're actually getting what they expect to find when they click on a link. A great test of your link text is to read it out of context and see if it still makes sense. If it does, visitors and search engines both should be able to look at it and have some idea of where they're headed when they click. And keep in mind that screen readers, they may present the links to users out of context, so this is especially important. Let's quickly review our SEO principles that we just covered. Write content that gives your users what they want. Incorporate keywords. Write unique descriptive metadata, page titles and page descriptions for every page. Write simple, direct, descriptive URLs. And don't use click here for your link text. So we have mentioned accessibility considerations a few times. Web accessibility means that your websites and digital tools are designed and developed so that everyone can use them, including people with disabilities. And more specifically, it means that people can perceive, understand, navigate, and interact with your site. We have a lot of accessibility resources and tips on our website at geometric.com, but we'll just go through at a high level some things to take away from this conversation. Web accessibility encompasses all disabilities that affect access to the web, including conditions that affect visual, auditory, physical, cognitive, neurological, and speech abilities. And making your website accessible not only benefits people who have disabilities, but it benefits people who may be using a mobile phone or a smartwatch or another type of device with a small screen, It can benefit folks with temporary disabilities, such as a broken arm or lost glasses, or people with situational limitations, such as they're viewing your website in bright sunlight or in an environment where they can't listen to audio, so they need to rely on captions. Making your site accessible also can benefit people using a slow internet connection or have limited bandwidth. When you make sure your organization's digital content is accessible, you're not only enhancing usability for all of your audiences, you're also complying with the law. So Section 1557 of the Affordable Care Act, which went into effect in 2016, requires healthcare organizations to take steps to ensure communication with people who do have disabilities is as effective as communication with people who do not. Organizations that don't do this could face lawsuits or the loss of federal funding through Medicare or Medicaid. Ultimately, though, we encourage organizations that we work with to work toward website accessibility because it's the right thing to do for patients, families, employees, and your community. Much of what we've already covered in this training will help you create accessible content, but let's go over some of the ways content can impact accessibility. When we think of accessibility, we often think of technology and design, but the way you write and structure your content plays a big role in accessibility too. If you follow the guidelines we've laid out, your content should align with current accessibility standards, but here are some specific items to keep an eye on. Keep your content within a clear and understandable hierarchy, using headings and subheadings to organize your content. Content should be written as clearly and simply as possible. Explain abbreviations or technical terms on first reference, and use descriptive text for links. Never use click here. Don't rely solely on sensory perception to identify page content. So instead of writing click the green button, write click the green button, label go. Include captions for videos and transcripts for audio files. And follow guidelines for making PDFs and other files accessible. Don't embed text and images. And don't use graphics alone to display information. Always have text-based alternatives. The only exception for embedded text and images is logos. So what's an alt text? If you have an image or other piece of non-text content on your page, an alt text is the text alternative that describes what that piece of content shows, and it's read by screen readers. So it's important for those with visual or certain cognitive disabilities to be able to understand the content on your site. How to write alt text. Write concise alt text that accurately describes the content of the image. Alt text should convey the same information or emotion that a user would experience if they could see the photo. And you don't need to repeat page content, including image captions in the alt text. For guidelines on when alt text is needed, visit the World Wide Web Consortium's W3C alt decision tree, noted there on the right. All right, well, let's talk through a few additional resources that are content related that you may be interested in. So if you found all of the information that we covered a little bit overwhelming today, or maybe you want to have a handy reminder of some of the topics we covered, we have a great checklist on our website that you can print and keep handy at your desk. I think this is a great resource for checking off and making sure that a piece of content that you've written follows all of the guidelines that we've discussed in this presentation, especially, whether you're just getting started and these topics are new to you, or if you're a seasoned veteran, it's always good to have this kind of asset. As Cole mentioned, we recently updated our Web Writing for Healthcare ebook. It has a lot of information in addition to what we covered today, a lot of detailed links to sources and other tools that you might be interested in learning more about. And if you fill out the survey at the end of today's presentation, we'll send you an updated copy of this guide. I just wanted to note something really quickly as we're finishing up and moving into the questions and answers segment of our conversation today. So there are certain content pain points that we at Geometrics seem to hear pretty often from our clients, and that's things like our content seems to be getting stale or outdated because we're so focused on all of the other things demanding our attention. We're not sure even all of the content that exists on our site. We don't know who is responsible for updating our content or reviewing it, or we're having certain redundancies or reworking in our content development processes. Typically, we find that content becomes hard to manage because of factors at an organizational level. So, competing interests, time, staff, and budget constraints, confusing decision authority and structure, who can say yes or no, that's not clear. And then documentation for these standards, policies, and processes. Maybe they don't exist, maybe they're hard to follow, maybe it's been a while since they've been reviewed. So, if these are concerns that your team is experiencing, the solution is content governance. Digital governance is a framework for establishing accountability, roles, and decision-making authority for an organization's digital presence by addressing strategy, policy, and standards. So stay tuned for a future Geometric webinar on this topic, or reach out if you're interested in learning more on how governance can not only solve pain points for your team, but offer a wide range of benefits to your website users. All right, and I think we have time for a couple questions, Cole.
Yes. Thanks, Stella. Great stuff in there. So we had a few questions come in. So the first one, someone's wondering, is it better to use one universal call to action for all your services content or customize the call to action for each section or page you write?
Absolutely. Great question. So for a page, the call to action should be unique to that page. Who is that page's audience? Service lines can have different calls to action or different conversion points depending on the service, right? So for a primary care service line, the call to action is probably going to be pretty different from the action you want someone who's interested in joint replacement taking. So we always recommend that your calls to action be unique and driven by what the page topic is and who that audience is that you're trying to reach.
So you're not going to be able to get away with schedule an appointment as your call to action just site-wide, huh?
No.
Okay. All right. Next question we had, how often should a web page be updated? And so you were talking about that a little bit right at the end there with content getting stale. So in your opinion, expertise, how often should a web page be updated?
Well, I think a wise person once said that it depends. So there's two different types of updates or approaches to updates that a page of content may need based on a governance perspective. So there could be planned content updates. So maybe every year I review a page to make sure that it's accurate, it's in keeping with our latest brand guidelines, and it accurately describes all of our services and things of that nature. An unplanned update would be maybe we just got this super cool piece of technology and we need to make sure that that's included on the website. So there's two different ways to do it. Governance can kind of help you put some rules around what would trigger a planned update versus an unplanned update. So there's no hard and fast rule around when a page should be updated, but as we know, Google and other search engines appreciate refreshed content that's regularly reviewed and updated.
Okay. Looks like we have one more that I can see right now. So this last question, the person's wondering, is it more effective to use a serious or friendly voice and tone for healthcare audiences?
I think it depends on your brand. If you think about like the voice and term or the voice and tone, what are the words that you would want associated with your brand? Do you want to be professional but approachable or authoritative? You definitely want to start with where you want your brand to be. And I guess my main recommendation would be to avoid frightening your users. So try to always approach them with
It's always a good
empathy.
recommendation.
You'd be surprised. So try to reassure them. They might be going through a kind of a scary time. And so not only is it the empathetic thing to do to make sure your content is positive, but it can help them feel more confident taking that next step, whether that's picking up the phone and making an appointment or whatever that call to action is.
Okay. Like I said, I think that wraps up all the questions that we had today. So Thanks so much, everybody, for joining us. I wanted to remind you of just a couple, those just kind of rehashing the assets that we had for today. First, we are offering a free content checkup. You can meet one-on-one with a content expert like Stella, and you can get signed up for one of those checkups by going to geometric.com/content-checkup. We are putting the finishing touches on our Web Writing for Healthcare ebook, a new edition of that. So if you'll give us, just a couple more days, we'll have that to you. Hopefully, we will have that in the post-webinar email that we send out to all of our registrants. But to make sure you get a copy, make sure that you mark that you are interested in the survey that pops up after the webinar. And speaking of webinars, next month in June, we have David Sturz talking about web content management, trends that matter for healthcare. And so you can get signed up for that at geometric.com/webinars. And with that, I will bid everyone adieu and have a great Memorial Day weekend, everyone.